Amlodipine. For millions of seniors, it's more than just a pill, it's a lifeline. A daily ritual prescribed to battle the silent killer, high blood pressure. It's the medication your doctor likely called safe, effective, and well-tolerated. A trusted ally in protecting your heart and brain. And in many ways, it is an effective tool for lowering that top number on the cuff. But what if I told you that this ally operates under a strict set of hidden rules? What if there are common, everyday things, habits, foods, supplements, even other healthy practices that you might be doing right now that are silently sabotaging this medication, or worse, unlocking a cascade of hidden side effects that no one ever warned you about? This is the shocking truth that is often lost in the shuffle of a busy doctor's visit. Taking amlodipine isn't just about swallowing a pill. It's about understanding how that pill interacts with your entire life. Because this is the great inversion. The very mechanism that makes amlodipine work, its ability to block calcium channels, is also its greatest vulnerability. Why? Because calcium is the universal language of your cells. It's not just for muscles. It's the spark for nerve communication, the trigger for hormone release, the signal for immune cell activation. It's everywhere. So when you take a drug that systemically muffles this language, you need to be extra careful about other things that also influence that language, or rely on it. That is the secret. That is the source of these hidden rules. So over the course of this video, we are not just going to list "don't take drug X," we are going to expose 13 hidden things, actions, habits, supplements that you should never do while taking amlodipine. And most importantly, we are going to explain why, linking each one back to the calcium channel blocker mechanism or its downstream consequences. Because understanding the why is the key to staying safe and getting the most out of your treatment, or even realizing if the drug itself might be the source of your other mysterious symptoms. So let's start with the obvious but often ignored dangers, the things that can dangerously interfere with how much amlodipine is actually in your blood. Thing number 1. Never consume large amounts of grapefruit or grapefruit juice. Now, you've probably heard this one, but do you know why? This is not a myth. Grapefruit contains compounds, called furanocoumarins, that inhibit a critical enzyme in your liver, CYP3A4. This enzyme is responsible for breaking down amlodipine, so when you inhibit the enzyme, the amlodipine doesn't get broken down. Its levels in your blood can skyrocket, sometimes by 200 or 300%. This turns your normal dose into a massive overdose, dramatically increasing your risk of all side effects, including a dangerous drop in blood pressure. It is not worth the risk. Just avoid it completely. Now, let's flip the coin. Thing number 2, never take St. John's wort without explicit doctor approval. This popular herbal supplement for mood does the exact opposite of grapefruit. It induces, or speeds up, that same CYP3A4 enzyme. So it makes your liver break down amlodipine faster, drastically lowering the levels in your blood, potentially making the drug completely ineffective. You think you are being helped by the herb, but you are silently sabotaging your blood pressure medication. Always tell your doctor about all herbs and supplements, especially this one. Finally, let's talk about direct conflict. Number 3. Never combine amlodipine with certain over-the-counter cold and allergy medications, specifically decongestants containing pseudoephedrine or phenylephrine, found in many D formulas like Sudafed D or Claritin D. Why? Because amlodipine is a vasodilator. It widens blood vessels. These decongestants are vasoconstrictors. They narrow blood vessels. You are literally taking two drugs that are fighting each other. The decongestant can directly counteract the blood pressure-lowering effect of amlodipine, potentially causing dangerous spikes. Always read labels. Always ask your pharmacist for safer alternatives, like saline sprays or antihistamines without the D. These first 3 are about drug levels and direct conflicts. But the next never do is about a mineral that works on the same channel as amlodipine, and ignoring it is a recipe for disaster. In our next block, I'm going to reveal why your magnesium levels are critical when you take this drug.
So we've established the first 3 never do's. Avoid grapefruit, number 1. potential overdose. Avoid St. John's wort. Number 2, potential ineffectiveness. And avoid certain decongestants. Number 3, direct conflict. These are about drug levels and direct fights. But I promised you the next never do was about a mineral that works on the same channel as amlodipine, and ignoring it is a recipe for disaster. This brings us to thing number 4. Never ignore your magnesium levels. Now, why is this so critically important? It's important because of the great inversion. This is the shocking science. Magnesium is nature's calcium channel blocker. Yes, magnesium and calcium are natural antagonists. They compete for the same channels. Calcium tells muscles to contract. Magnesium tells them to relax. So amlodipine works by artificially blocking the calcium channel, but magnesium does this naturally and safely. Now, what happens in most seniors? They are chronically deficient in magnesium due to poor diet, low stomach acid preventing absorption, and other medications like diuretics. So their natural CCB, magnesium, is already missing. This deficiency alone is a major hidden cause of high blood pressure. But what happens when you add amlodipine on top of a magnesium deficiency? This is the danger. Scenario A, less effective drug. If your magnesium is so low, your cells might upregulate, increase the number of calcium channels in a desperate attempt to get any calcium signal through. This can make your standard dose of amlodipine less effective, because there are more keyholes for the calcium to sneak through. Scenario B, worse side effects. Amlodipine itself can further deplete magnesium levels, and low magnesium is known to cause or worsen many of the same side effects blamed on amlodipine, like muscle cramps, fatigue, irregular heartbeats, and even anxiety. So your side effects might not be the drug, they might be an underlying magnesium deficiency that the drug is exposing or worsening. That is the shocking truth. Ignoring magnesium while taking a calcium channel blocker is playing with fire. Get your levels tested. Talk to your doctor about magnesium-rich foods or appropriate supplementation like magnesium glycinate or malate. It is essential for safety and effectiveness, and I know this information about nutrient interactions and hidden deficiencies adds another layer to managing your blood pressure. But understanding these connections is key to finding holistic solutions. And on that note, there's fascinating research on how specific, natural ingredients from heart-healthy villages can support your cardiovascular system differently. I've placed a link to this unique approach in the first pinned comment for anyone seeking that peace of mind. Now, let's talk about stopping the drug. Thing number 5, never suddenly stop taking amlodipine unless directed by your doctor. This seems obvious, but why is it so dangerous? It's dangerous because of rebound hypertension. Think about it. Your body is smart. When you block calcium channels every single day, your body adapts. It tries to fight back. It often increases the number of calcium channels on your cells, upregulation, trying to catch any calcium it can. So, what happens if you suddenly stop taking the drug? The blocker is gone, but you now have more calcium channels than before, and they are wide open. The result? A massive, sudden influx of calcium into your muscle cells, causing a violent constriction of your arteries and a rapid, dangerous spike in your blood pressure, potentially far higher than it was before you started the drug. Never stop amlodipine cold turkey. Always taper off slowly under your doctor's supervision. Finally, for this block, let's talk about fluids. Thing number 6, never allow yourself to get severely dehydrated. Why? 2 critical reasons. Reason A, drug concentration. When you are dehydrated, your blood volume decreases. This means the concentration of the amlodipine already in your system increases. Your normal dose effectively becomes a higher dose, increasing your risk of side effects like dizziness, lightheadedness, or an excessive drop in pressure. Reason B, synergistic effects. Dehydration itself puts stress on your cardiovascular system. It thickens your blood, making it harder to pump, and it can trigger the release of stress hormones like vasopressin, which constrict blood vessels. This directly fights what the amlodipine is trying to do. Staying adequately hydrated, preferably with electrolytes, not just empty water, is crucial for the drug to work safely and effectively. So, we've covered drug interactions, mineral balance, stopping, and hydration. But what about food? What about the timing of your meals? What about common supplements that seem healthy but could be disrupting the calcium balance even further? In our next block, I'm going to reveal the next set of never-dos, the ones hiding in your kitchen and your supplement cabinet.
We have now covered the first 6 critical never-dos while taking amlodipine, avoiding grapefruit, number 1, St. John's wort, number 2, and certain decongestants, number 3, due to drug-level interactions. Paying close attention to your magnesium levels, number 4, nature's CCB. Never suddenly stopping the drug, number 5, rebound hypertension. And avoiding severe dehydration, number 6, drug concentration and stress. These are foundational, but I promised you the next set of dangers were hiding in your kitchen and your supplement cabinet. The things that seem healthy but can silently sabotage your amlodipine treatment. This brings us to thing number 7. Never take high-dose calcium supplements without doctor consultation. Now, why is this so critically important? It's important because of the great inversion. This is the shocking yet obvious conflict that is almost always ignored. What is amlodipine? It is a calcium channel blocker. Its entire job is to reduce the amount of calcium getting into your cells. So what are you doing when you swallow a high-dose, 1,000 milligrams calcium supplement, often pushed for bone health? You are flooding your system with the very mineral the drug is trying to block. This is like pressing the brake pedal, amlodipine, and the gas pedal, high-dose calcium, at the exact same time. What is the result? Potential ineffectiveness. The excess calcium in your bloodstream can overwhelm the amlodipine's blocking effect, essentially outcompeting the drug for the calcium channels, potentially making your amlodipine less effective at lowering blood pressure. You think you are helping your bones, but you might be sabotaging your heart. Increased risk of side effects. While controversial, some research suggests high-dose calcium supplementation itself, even without amlodipine, might increase the risk of cardiovascular events or kidney stones in some individuals. Combining this high load with a drug that alters calcium signaling needs careful consideration. The point is not that all calcium is bad. The point is that megadosing calcium while taking a calcium blocker is working at cross purposes and requires a serious conversation with your doctor about the real risks and benefits for you. Now, let's talk about the other mineral everyone obsesses about. Thing number 8. Never continue eating a high-sodium processed food diet. Wait, didn't you say salt wasn't the only problem? Yes, I did. But this is the critical distinction. While sodium might not be the root cause for everyone, actively flooding your body with excess sodium while taking a drug designed to lower pressure is like trying to bail water out of a boat while simultaneously drilling holes in the bottom. Why? Direct counteraction. High sodium intake directly causes your body to retain water to dilute the salt. This increases blood volume, which directly increases blood pressure, literally fighting the exact effect the amlodipine is trying to achieve. Increased workload. You are forcing the amlodipine to work much harder than it needs to, potentially requiring higher doses and thus more side effect risk to achieve the same result. Amlodipine is a tool. It is not a free pass to ignore the fundamentals. Reducing your intake of processed, high-sodium foods is still a critical part of any blood pressure management plan, especially when using medication. Now, let's talk about sodium's twin. Thing number 9, never ignore your potassium intake. This follows directly from number 8. Why? Because of the sodium-potassium pump. That tiny engine in every cell that kicks sodium out and pulls potassium in. This pump is your body's own natural diuretic and blood pressure regulator. But this pump requires potassium to function. So, when you eat the standard American diet, which is chemically engineered to be low potassium and high sodium, your pumps break. They cannot kick the sodium out, Sodium builds up inside your cells, water follows, your cells swell, your blood volume drops, your kidneys panic and retain more sodium, and your pressure skyrockets. Amlodipine does nothing to fix this broken pump. So, if you rely only on the pill and you ignore your potassium intake, you are leaving one of the most powerful natural blood pressure regulators offline. Actively working to increase your potassium intake through whole foods like avocados, sweet potatoes, greens, bananas is essential to help the amlodipine do its job. It fixes the fluid balance that the drug cannot. Finally, for this block, let's touch on other supplements. Thing number 10. Never assume natural means safe. Beware certain herbs. While St. John's wort, number 2, is the most well-known interaction, other common herbs can also potentially cause problems. Examples: licorice root can raise blood pressure and deplete potassium. Ginseng can interfere with blood pressure. Ephedra or mahuang, a dangerous stimulant. Even things like ginkgo biloba or high-dose garlic might increase the blood-thinning effect if you are on blood thinners along with amlodipine. The point is not to create fear. The point is transparency. Your doctor and pharmacist need to know every single thing you are taking. Natural does not mean no biological effect. Always ask before adding any new herb or supplement. So, we've covered drug interactions, mineral balance, mag and calcium, stopping, hydration, diet, sodium and potassium, and herbs. But what about simple everyday actions? What about how you stand up? What about how much you drink of other things? What about that pain in your gums? In our final block, I'm going to reveal the last 3 never-dos, the ones hiding in your daily habits.
We have now navigated through the first 10 critical never-dos while taking amlodipine, covering dangerous drug and herb interactions, grapefruit, St. John's wort, decongestants, other herbs, crucial mineral balance issues, magnesium, calcium, sodium, potassium, the perils of suddenly stopping, and the importance of hydration. These are foundational for safety and effectiveness. But I promised you the final dangers were hiding in your simple everyday habits, the things you do without thinking. This brings us to thing number 11. Never jump up too quickly from sitting or lying down. Now, why is this so critical specifically with amlodipine? It's critical because of orthostatic hypotension. This is the medical term for that sudden dizziness, lightheadedness, or even fainting you feel when you stand up too fast. And amlodipine significantly increases your risk of experiencing this. Why? Remember, amlodipine works by relaxing your blood vessels. This is good for your overall pressure, but it also blunts your body's natural rapid response system that is supposed to instantly constrict your leg vessels when you stand up to prevent blood from pooling in your feet and keep it flowing to your brain. So, amlodipine already makes this quick stand response sluggish. Now, add in the fact that seniors also often have baroreflex sensitivity failure, those broken pressure sensors we talked about in another video, and you have a recipe for disaster. The simple act of standing up too quickly can cause a sudden, dramatic drop in blood pressure, starving your brain of oxygen momentarily, leading to dizziness or worse, a fall. The never do is simple. Move slowly, especially in the morning. Sit on the edge of the bed for a minute, stand up slowly, hold on to something if needed. Give your body time to adjust. It is a simple habit that can prevent a catastrophic injury. Now, let's talk about another common habit. Thing number 12. Never consume excessive alcohol. Why? Alcohol itself is a vasodilator. It relaxes blood vessels just like amlodipine. So, when you combine the two, you can get a synergistic effect, meaning the combined blood pressure lowering effect can be much greater than either one alone. This can lead to an excessive drop in blood pressure, causing dizziness, fainting, or worsening orthostatic hypotension number 11. Furthermore, alcohol can also interfere with the liver enzymes like CYP3A4 that metabolize amlodipine, potentially altering the drug levels in your blood, similar to grapefruit.
And chronic heavy drinking is itself a major risk factor for developing high blood pressure and damaging your heart, effectively canceling out any benefit from the medication. Moderate alcohol might be okay, discuss with your doctor, but excessive drinking while on amlodipine is playing with fire. Finally, the most surprising, most ignored, and potentially most visually distressing never-do, thing number 13. Never neglect your oral hygiene, especially your gums. What? What does brushing your teeth have to do with your blood pressure pill? This is the shocking, hidden side effect that almost no one talks about. Amlodipine is notorious for causing a condition called gingival hyperplasia. What is that? It is the overgrowth of your gum tissue. Your gums can become swollen, puffy, tender, bleed easily, and in severe cases, they can literally grow over your teeth. Why does this happen? The exact mechanism isn't fully understood, but it likely relates back to amlodipine's effect on calcium signaling within the gum tissue cells, interfering with the normal regulation of cell growth and collagen production. Now, why is neglecting oral hygiene the never-do? Because poor oral hygiene, plaque buildup, gingivitis, gum inflammation, dramatically increases the risk and severity of this overgrowth. The inflammation seems to act synergistically with the drug's effect. So, meticulous oral hygiene, brushing twice daily, flossing daily, and regular dental checkups are not just good habits, they are essential preventative medicine if you are taking amlodipine. Catching this early allows your dentist and doctor to intervene, sometimes just by improving hygiene, sometimes by adjusting medication. Ignoring it can lead to serious dental problems and significant distress. That is the final hidden danger. So, let's bring it all back. Let's look at the total picture. This is the circularity. This is the answer to the question we ask at the very beginning. That safe and effective pill? It is effective, but its safety depends entirely on how you use it and what you combine it with. Amlodipine works by muffling the universal language of calcium. Therefore, you must never interfere with its metabolism, grapefruit number 1, St. John's wort number 2, directly fight its action, decongestants number 3, high-dose calcium number 7, ignore its natural partner, magnesium number 4, create rebound effects, stopping suddenly number 5, concentrate the dose, dehydration number 6, undermine its goal, high sodium diet number 8, neglect its helper, potassium number 9, risk unknown interactions, herbs number 10, trigger dangerous drops, standing quickly number 11, excessive alcohol number 12, and exacerbate hidden side effects, poor oral hygiene number 13. Understanding these 13 never-dos is not about creating fear, it is about empowerment. It is about making this tool work for you, safely and effectively, while also inspiring you to address the hidden root causes so that maybe one day you won't need the tool at all. That is the simple, ignored truth. Pills are tools, knowledge is power. That is the secret. And if this message, if this deeper understanding of your medication has empowered you today, then please hit that subscribe button. Our entire mission is to uncover these simple, ignored truths that give you back control. Because now that you understand the potential hidden interactions of amlodipine, you also need to understand the potential hidden side effects. The video Amlodipine's Hidden Side Effects No One Talks About, Skin, Gut, and Mind reveals exactly how this drug might be impacting other parts of your body. Click on the video on your screen right now to learn the language your body might be speaking about the drug itself.